just to show that nothing is in here, nothing is on the walls to cheat, or anything like that. We also have a sim man here with us. He's intubated. He won't bother us. Okay. I'm going to close the curtain for some privacy. I'm going to wash my hands. Hi, my name is Selena. I'm going to be your student nurse today. Can you please state your name and birthday for me?
Tara 9696.
Okay, Tara, today we're going to be doing a head-to-toe assessment. I just have a couple of questions for you. Are you in any pain today?
No.
Okay, do you have any allergies I should be aware of?
No.
No? Okay. What's today's date?
April 12, 2016.
Okay, what season are we in?
Spring.
Spring, and then where are we at?
School.
School, great. She's alert and oriented times 3. Your general mood seems to be appropriate for the situation. She does not have any signs of illness or anything like that, and her affect is appropriate as well. Her speech is not slurred. Her speech is appropriate for the situation and all that. First, we're going to start off with testing your scalp. If you could put your chin to your chest, please. Thank you. I don't see any critters, any lesions, any redness or swelling or anything like that in your scalp. Okay, you can go ahead and lift your head up for me. Next, I'm going to test your eyes. I'm going to have you look straight at me. Your eyes are symmetrical. Your pupils are round. I'm going to test your light accommodation, so I just want you to take a look at my pen light and just watch it, okay? Okay. Her eyes accommodated appropriately. They both watched the pen light as it moved towards her nose. Next, I'm going to test your light accommodation reflex to see with your right and left eye, okay? So if you could just look at my nose. Okay, both of her eyes constricted and dilated appropriately and at the same time. Next, I'm going to look at your conjunctiva. If you could just look up for me, please. Okay, conjunctiva are pink and moist. We're going to look into your mouth. Can you open your mouth for me, please? Thank you. Your gums are intact, so are your inner and buccal mucosa. You have all 32 teeth. I don't see any cavities. Your tongue is midline, and your uvula is midline as well. Can you please say ah for me?
Ah.
Okay. Your uvula was mobile, and she did have, her tonsils are present, and they are graded at a 1 to 2. You can go ahead and close your mouth for me, please. Next, I'm going to have you close your eyes and tell me where I'm touching, okay?
Forehead, nose, cheek, chin.
Okay. Can you puff out your cheeks for me, please? And smile. Great. Beautiful smile. Next, next I'm going to, okay. Next I'm going to have you bite down for me. Great. Cranial nerve 5 and 7 are intact. Next I'm going to listen or test your carotid artery. I'm going to palpate for it. One at a time, starting on your left-hand side. Okay. Move on to your right. Great job. Next, I'm going to auscultate for any bruise using the bell of my stethoscope. Once I set my stethoscope down, just hold your breath for me, okay? Wonderful. Let's do on this side. Great job. I did not hear any bruise in your one listening to your carotid artery. Next, I'm going to listen to your heart. I'm going to be using the diaphragm of my stethoscope, using the ape to man method, starting with your aortic. Okay? Just going to put these on. Okay. Listening in the aortic area, which is in the second intercostal space, right sternal border. Now pulmonic, second intercostal space, left sternal border. Herbs, which is in the third intercostal space, left sternal border. And your tricuspid, which is in the fourth intercostal space, left sternal border. Last but not least will be your mitral, which is in your fifth intercostal space, midclavicular line. This is also where I will listen for 60 seconds for her apical pulse. 60 seconds have passed. Now I'm going to flip my stethoscope over to the bell and then go back up listening in the same ape to man method, but going in reverse. So starting with her mitral. then your tricuspid, herbs, pulmonic, and aortic. Great job. There were no abnormal sounds in her heart. I did not hear any murmurs or anything like that. Next, we're going to listen in for your lungs. I'm going to be doing 10 spaces, okay? Just take a deep breath each time I set my stethoscope down. 3, 4, 5, 6, 7, 8, 9, 10. Okay, then we're going to listen onto your back. 1, 2, 3, 4, 5, 6, 7, 8. Your arm for me, please. 9 and 10. Great job. There were no adventitious lung sounds. I did not hear any crackling, wheezing, or anything like that. Next, I'm going to have you lay back for me. Okay. We're just going to take a look at your abdomen. Are you okay with me pulling your shirt up? I know I just did it. Alrighty. We're going to start off with talking about the organs that are in each of your quadrants. We're going to start off with your right lower quadrant. Your right lower quadrant contains your right ovary, your right ureter, and your appendix. Next is your right upper quadrant that contains your liver, the head of your pancreas, and your gallbladder. The left upper quadrant contains your stomach, your spleen, and the body of the pancreas. And then your left lower quadrant contains your left ovary, your left ureter, and your sigmoid colon. Okay? The proper order of inspecting your abdomen is to inspect, auscultate, palpate, and then percuss. To do that, what we're going to do is we're going to start off with inspecting. I don't see any unnecessary lesions. The color seems to be all uniform, matches your skin tone, which is appropriate for your ethnicity. And then your contour is also flat. Okay? Next, we're going to go ahead and listen. I'm going to listen with the diaphragm of my stethoscope, and we are going to listen for any bowel sounds, okay? We're going to be starting in your right lower quadrant for each of these things. I'm going to auscultate now. Okay, bowel sounds were active in all 4 quadrants. Next, I'm going to palpate, and let me know if you feel any pain, okay? Any pain? No? Okay. Next, we're going to percuss. Okay. All sounds were, there was tympany in all quadrants except for in her right upper quadrant. That's because her liver is there. The sound was dull. Okay. You still don't feel any pain or anything like that? No? Okay. I'm going to go ahead and pull your shirt down. If you want to sit up for me, please. Okay. No jugular vein distension. I noticed as she sat up. And then I'm going to go ahead and look at your anterior-posterior ratio, which is a 2 to 1. Next, I'm going to go ahead and take a look at your upper extremities. Let's see. Your arms are appropriate skin tone, uniform with the rest of your body, no unnecessary redness, no lesions or moles or bumps or anything like that. I'm going to, your skin is pretty warm. I'm going to now feel for your brachial pulses, okay? Bilaterally, you are a 2+ in your brachial pulse. Let's feel your radial. Also a 2+ bilaterally in your radial pulses. Can you squeeze my fingers for me, please? Great job. I'm going to test for your capillary refill as well. Let's see. the color changes back within less than 3 seconds. Okay? Next I'm going to test for clubbing. Can you put your hands in the shape of a heart for me? Great job. I don't see any clubbing at all. So you can go ahead and put your hands down. Next I'm going to have you do your lower extremities, okay? I'm going to test your popliteal pulse. Maybe you can scoot up just a little bit. Thanks. Okay, popliteal pulse is a 1+ bilaterally. Next I'm going to do your dorsalis pedis pulse. Also a 1+ bilaterally, and then your tibial pulse. Also a 1+ bilaterally. I don't see any unnecessary lesions or on any scarring or anything like that. Hair is distributed evenly on both arms and on legs. Color is uniform and your legs are warm. Next I'm going to perform the Babinski test, which is just to test your reflexes, okay? Okay, here's this side. Okay, you pass the Babinski test, your toes did not flare out or anything like that. Okay, next I'm going to have you stand up for me, please, and I'm going to have you walk to that wall. Okay, gait is appropriate. She is not dragging any of her feet. Are you dizzy at all? Nope, no dizziness. And she walked with, she got up pretty quick, so she passed the get up and go test. Next I'm going to have you bend down and touch your toes for me. I'm going to test the alignment of your spine. Spine is straight, no signs of scoliosis or anything like that. Next I'm going to feel for your costovertebral angle, so I just want you to let me know if you feel any pain, okay?
Mm-hmm.
Any pain?
No.
Any pain?
No.
Nope, great. Go ahead and stand back up for me. Next I'm going to have you take a seat. Great job. And then you are, I'm trying to think if there's anything else. It's fine. Your
Just stop it. She can't
What
go that
is
long.
it?